Being 1:30, we'll call the Public Safety Committee meeting to order. Public comment, we have none. No one signed up. 3, approval of the January 5th, 2022 Public Safety Committee and the Joint Public Safety and Health and Human Services Committee minutes. 4, policy issue, or what is the wishes of the body?
Asked, move to approve.
Have a motion, do I have a second?
Supervisor Bozotto, second.
Supervisor Bozotto with a second. All in favor? Aye.
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 Any opposed? Motion carried. 4, policy issues discussion and potential committee determination, none. 5, operational functions required by statute, ordinance, or resolution, none. 6, educational presentations, outcome monitoring reports. If there's no objection, I'm going to move the awards C before A and B. Any objection by the body? If not, Mr. Billab.
Thank you, Chair Boots, for having us here today. We've got a number of awards that we would like to present. If I could have Corrections Officer Stevens, please come on up. Corrections Officer Keane, Mike Keane. Mike Keane, we got that now? All right. Nurse Alexis Miramontes, if you would come up, please. Corrections Officer Melissa Fleischman. And I believe Corrections Officer Nick Lesky is not here today. So the staff that you see standing before you here today were involved in an incident on October 21st at about 2:30 in the afternoon. On that day, Corrections Officer Mike Keane, who is the second one in line here, was doing his round through the jail when he observed an inmate that was unconscious, laying on the floor and convulsing in what we believe was a seizure. He immediately called for help and was assisted by Corrections Officer Stevens, Corrections Officer Mishka, and Corrections Officer Lesky, as well as Nurse Miramontes, who all came in order to render aid to this inmate. While they were there working with this inmate, the inmate was again convulsing and shaking, and Corrections Officer Stevens worked to secure the head and make sure that the person did not hurt themselves any further. While they were doing their initial medical assessment, they determined that there was no carotid pulse and no pulse in the lower extremities, and they applied an AED, which advised them that a shock should not be administered, but that instead they should start CPR. Corrections Officer Stevens and Nurse Miramontes got to work, and Corrections Officer Stevens doing the chest compressions and Nurse Miramontes doing the respirations, and they worked on that inmate until Wausau Fire arrived with the paramedic team. Because of their efforts, the inmate that they helped walked out of the hospital about a week later and went home. So their quick thinking, quick action, if not for the alertness of Corrections Officer Keane, we would have had a very different outcome in our jail for a medical issue that took place. For their efforts, we will be awarding Corrections Officer Stevens with a life-saving award and Nurse Miramontes a civilian commendation, which is the equivalent of our life-saving award. Corrections Officer Keane, Lesky, and Fleischman with commendations from the sheriff. The sheriff could not be here today. He normally presents these awards, but we would like to recognize them for the phenomenal work that they did that day back in October. So congratulations. Mike, I need you to stay up here. So, thank you. Turns out Mike's been busy up in the jail. Just 2 months after this incident, Mike was in the jail when he observed an inmate who was having an altercation, if you will, frustration expressed with other inmates, and our staff stepped in order to try to mediate that. The inmate didn't take it well and then got into a verbal altercation with another corrections officer in our jail. Mike stepped in and used his de-escalation skills and his communication skills and was de-escalating the inmate when the inmate basically gave up the argument and said, you know what, I don't want to live anymore. Decided that he was going to go up the stairs in one of our blocks where we have an elevated mezzanine and made his way to the top and was in the process of jumping off the mezzanine when Mike stepped into action, had been following the inmate, didn't allow him to get out of his reach, and was able to de-escalate that inmate with some of the tools that we have in order to bring that person safely back to the right side of the banister and then get that person to mental health. Had Mike not been, once again, alert like he always is in his duties, we would have had a very different outcome that day in the jail. For his efforts and for his quick thinking and reaction and his ability to not let fear get in the way, we're going to award Mike Keane the Sheriff's Life-Saving Award here today. So Mike, on behalf of Sheriff Parks, congratulations and excellent work. These last two awards, I think I'm going to try to do together. Although they're different and they're for different purposes, they kind of encompass the same type of logic or reasoning. So if I could get Deputy Jackie White to come to the front, as well as Corrections Officer Melissa Fleischman. Again, Melissa was just up here, so you're going to recognize her again. Over the last couple of years, the Sheriff's Office has been making a concerted effort to get out there and do more things in the community. Some of the things that you hear us speak about a lot is mental health and engaging the community and doing a better job in that regard. One of the programs that we started back in 2015, 2016 was the Crisis Assessment Response Team. And I know a lot of people have heard about the really important work that they do when they go out and they work with folks who are in some sort of a mental health crisis in the community. That is probably one of the most demanding jobs that we have right now because the volume of calls that we receive, the city of Wausau receives, and the surrounding area continue to mount. There's a number of programs that we have in place that not only mitigate those risks for our citizens, but also prepare officers who are not crisis officers to go out and do some of that same work. So a carrier program that we have to that, or a companion program, is something called CIT, or Crisis Intervention Team. Over the last 4 years or so, we've trained almost 200 officers in Marathon County on crisis intervention. And that only happens when somebody wants to step up, take the lead, and make that happen twice a year. That's a 40-hour program that's conducted where we bring in local mental health providers in order to help us teach that class to law enforcement officers. Now, when we first started that program, I had the ability to lean on a gentleman by the name of Bob Wilcox. Bob was a City of Wausau police officer for many years and just a go-getter when it came to working in the mental health field. And Bob and I started the program. Bob wound up retiring and COVID hit. Well, one day I get a call from Jackie White, Deputy White, who says, you know, I think we're ready to get CIT going again. Do you mind if I take the lead? And I'm like, I know how much work that is. You can have it. So Jackie didn't hesitate at all. I provided her some of the resource materials we have, and she took it and started running from there. So in addition to all of the CART work that she does, she also runs our CIT program here in Marathon County and is continuing to train local law enforcement, corrections officers, dispatchers on crisis intervention techniques. She ran a class last fall. She's got another one scheduled for April, I believe. And that program just continues to gain momentum. If not for Jackie's tenaciousness, that program likely would have stalled. And for that, we will be awarding Jackie today for all of her work with mental health work in the community, the Distinguished Service Medal from the Sheriff's Office. Now I have a similar story for Melissa. Well, Melissa, when was it? Do you think about 2016, 2017 or so? 2017, we had a corrections officer at the time who came to us and said, you know, I'd really like to start this program called Shop with a Cop. And it's something where we can get out in the community, we can work with kids and kind of break down some of the stigma there is between that barrier between law enforcement and the community. And this corrections officer, who was a phenomenal employee, left our employ about 2 years ago and went to go work for another employer in the community. When that happened, Melissa stepped up right away and said, I want to take it over. I want to be a part of this. I want to make sure that this keeps going. So Melissa was able to go out and fundraise and bring resources to the table, and that Shop with a Cop program continued. Well, one day she calls me and says, hey, I've got an idea. I want to do something called Cops and Bobbers, where we'll take kids fishing, we'll go down to Lake Wausau with a group of kids and do that type of a program. And better yet, I've got all the funding for the entire thing. All the equipment, all the food, everything we need, I've got a donor that's going to take care of us. So we went ahead and we did it. Recently, she approached me and said, I've got an idea for a third program. The third program that we're going to run is called Badges and Bullseyes, and it's an archery program that we will be doing with youth in our community on top of Shop with a Cop and the Cops and Bobbers. Once again, she secured all the funding for that program. So we have local community donors who are behind these programs and making them happen every day. And the only way that that happens is people like Melissa getting out there, getting the word out, and working with local business leaders in order to make this happen. So for all of her efforts in keeping these great community programs going, I've got a Sheriff's Award for her for an Exceptional Service Medal. And I apologize for taking so much of the first part of your meeting here, but we think it's important that they be recognized and appreciate you giving us the time here today to do that. So thank you.
Thank you, Chief Deputy Billup. Moving on, if nobody's in disagreement, we would take A actually next. Challenges to rural emergency medical services and what may be the role in the county. So a little bit of background. Keith Longenhan will actually give us a little update, but we also have our emergency management person. And with that, I guess I'll just turn it over to you, Lance. Phil, you want to, I guess, just turn it over to Phil.
All right, good afternoon, everyone, and happy Groundhog's Day. May I share my screen, please?
Keith, you can come right up here if you want.
Yeah, Phil, you should be able to share your screen.
Sure. Does that microphone work?
All right, thank you. Hopefully you're seeing an EMS recruitment and retention slide.
Yes.
You are? Okay. All right, folks. Well, I'm reporting back to the committee on the University projects as a result of emergency medical services, or EMS, within Marathon County. Last semester, we had two groups of students work on a couple of projects for us. As you know, we have varying levels of fire and EMS throughout the county that include volunteer emergency medical responders, all the way up to career paramedics in the urban areas. Now, that approach has served our communities generally fairly well over the years. You know, the dedication of the part-time staff and the volunteer staff out there and their ability to sustain operations, especially in staffing shortfalls, especially during the COVID-19, it's really quite remarkable what they've been able to do over the years. However, this is the crux of the issue. At a time when EMS calls for services have increased, many departments have limited rosters of paid on-call members or volunteer members available, and they're having difficulty in recruiting new EMTs and, again, recruiting the ones they already have. Now, please keep in mind that the urban departments have a high ratio of dedicated paramedics or full-time paramedics compared to the other services in the county, where they're dealing with issues such as filling positions during the daytime hours, and then they got to look to other municipalities to fill in for them, which of course is going to result in longer response times. Now, we based our university projects on the current version of the county strategic plan. Objective 7.1 is to provide cost-effective and high-quality public safety services, and Objective 12.3 is to promote cost-effective public services. Now, let's get into what the presentation is that the students came up for us. Now, again, there's two different groups, so I'm going to go through the EMS recruitment and retention findings and recommendations first. And here's the team. As you can see, it's Sophia, Sean, and Alexander put this together for us. And if this is a report that you would like to see, can everyone see okay? Okay. If you would like the link to go to this site, or if you'd like a written report, please reach out to me. I'll be happy to send it to you. Now, here's one of the things that they found. In 2020, nearly a third of the workforce left their ambulance company after less than a year, and 11% left within the first 3 months of working on an ambulance service. Now, this was a national publication that they pulled this through, but nonetheless, you can see the impact and some of the issues that are going on out there, not just in Marathon County, but across the state and across the country. What they took a look at is the introduction as a public health issue. They talked a little bit about 3 interventions to help improve recruitment and retention, and then they did come up with some conclusions as well. Now, I just have to ask the audience, can you see this marker?
Yeah, we can see
Maybe
the
you
slide,
can-
Phil.
Yes. The mark.
The slide, but how about the pen making a marker?
Yeah, we
You
can
can
see
see
it.
it?
Yes.
Okay, very good, thank you. Now, they took a look at this and they called it a public health issue. Now, we combine the two a lot across the country and certainly across this county and the state, but EMS, they consider it a public health issue, an extension of health services, not fire service. So please keep that in mind. And they took a look at the recruitment and retention of keeping EMS workers within the county and within the industry. One of the solutions, the first thing they came up with was an idea of having ES curriculum in the high schools. What is a CTE program? That is a career technical education. That's what that acronym stands for. Essentially what it is, it's an EMS program that trains students for a technical career, in this case, emergency medical service. While students are in school, in high school, they'll learn about airway management, patient assessment, EMS operations, and upon completion of their coursework in high school, they become a licensed EMT and they can go out into the field. Now, they have had some success with this in Wisconsin. The Mount Horeb Fire Department, which if you don't know, that's south and west of Madison, they have a volunteer fire department. They tried it down there in their municipality, and they were able to have 10 people join up their ambulance service after completion of the course. They had pretty good success with that. Just an idea on what they've seen out there that is an idea to get some new folks into the field for the recruitment part of it. Some of the things that they ran into and how to go forward with that, they need to establish a partnership between the EMS departments in the area and the school systems. They need to identify and select the students for the program because it is a licensure. When you complete the work and you're an EMT, you are licensed by the state of Wisconsin. So you want to have students that are able to become licensed, and you have to determine the mode of instruction in the school or how that's going to go forward. Whether it's an instructor from the school, instructor from the technical college, something that would have to be worked out and researched a bit more. And there's an evaluation component of it as well. But that's one of the ideas that they came up with. The second thing they came up with was conduct a survey, a burnout survey to all EMS personnel in the county to find out how are they doing, what's their mental health, what do they think about EMS, what can be done differently, really get their state of mind. And it's such a critical thing to do, folks. If you look at this as far as burnout, fatigue, chronic stress, PTSD, and whatnot, it's been found that EMS providers are 1.39 times more likely to commit suicide than the general public. So the concerns are out there as far as the mental stress that goes on there and helping the EMS agencies deal with issues that they're dealing with out in the field. But again, they're recommended that a survey be sent out to the county EMS providers to find out what exactly is going on. And here are some of the surveys that they drew their examples from and their evidence from as well, whether it was in Suffolk County, New York, Minnesota, and West Virginia. Again, this would take a partnership. Someone would have to develop these surveys. Someone would have to collate the surveys, get them out, and analyze and evaluate them, and then apply whatever the findings are into practice. The third thing that came up, and the final thing from this group, is to develop a community coalition and an interest group. Now, let me tell you a little bit about what that is. And you can see on the slide as well, there's bullets, what it talks about. Pre-COVID, I developed an EMS interest group for the Marathon County EMS providers with the intent of just getting the EMS agencies together to talk about common issues. Maybe it's training issues, maybe it's protocols, maybe it's other issues such as purchasing, supplies, what have you. Is there some way that we can come together to discuss these issues and just be standardized across the county, or at least talk about these issues on a common setting? We met 3 or 4 times, then COVID kicked off, and that was pretty much the end of the interest group. They are recommending that we reinvigorate that or bring that back to life as a group to talk about those very issues, and along with the outreach. And maybe there's something that's there as far as making sure that they're getting new members, recruiting members, and maintaining the members as well, making sure that their voices are heard in a setting for Marathon County. Now, they do talk a little bit about what some of the benefits of that is, that there's shared resources and you can buy supplies at a more cheaper rate because you're buying them in bulk. There might be more additional training opportunities because you're not looking at just one agency. Now you're looking at a group of agencies, so you can bring more students to the table. Again, to make that happen, you have to establish a lead person. You have to reach out to the EMS agencies to see who's interested in participating in it, develop an agenda, everything that goes along with having a group set together and put together, and really think long term. There's some challenges with getting a group together and keeping it going. Because these groups, they tend to have a great amount of interest at the beginning, but as time goes on, people tend to fade away and it just fizzles out. That's what is the challenge with these groups, but it's a great idea. So again, for the recruitment and retention group, what they looked at is the surveys, the high school students, and finally reinvigorating the EMS interest group. And acknowledgements that went along with that. Before I go forward with the next from university, does anyone have any questions or comments?
Any questions by the committee?
This Supervisor Mask.
Go ahead, Supervisor Mask.
I don't have any questions, but Phil, this is remarkable. I think that if we could get this rolling in high schools and pique the interest at a young age, we might have some hope at retaining people later on, because I have a nephew who is 30 years old, and he is a volunteer fireman in a township fire department. And I have so much respect for him that he's willing to go out and do it. And we are losing people all the time. So kudos to you for this. I hope that we can make this work.
Thank you very much for your comments. I appreciate that. I think this is an intriguing concept. It's something that we can certainly look at more and explore it, and hopefully bring it on board. It certainly would pique the interest of the younger folks, I would hope. There was certainly a lot of interest in Mount Horeb.
I think you would find it here.
Excellent, excellent. All right, let me move on. The next one is EMS interventions for increased efficiency and sustainability. Now, this one was more of a strategic plan and how EMS is operating in the county. We did get into consolidation. We didn't talk about merging, nothing like that. But we just talked a little bit more about what are some of the things that can be done outside of those areas. And we'll get into that a little bit more. And here is the team that put this presentation together. Again, we mentioned this before, but I'll mention it again. It's a public health issue, not a fire department issue. This is an extension of healthcare, and that's been stressed a lot. Now, we're taking a look at the increased numbers of EMS calls in Marathon County, but there really hasn't been an increase in resources. You may be aware of this. EMS receives a significant amount of non-emergency calls daily. Calls that come into 911 that don't necessarily require or dictate an emergency ambulance response. And it's something that the group was taking a look at. How can we address that issue? When you do have a significant amount of non-emergency calls daily, how does that impact the operations across the county? Well, you're going to have your emergency ambulances tied up on other calls, so the response time is going to go up. There's going to be an increased cost to the system. There's more maintenance. There's more work and wear and tear on the vehicles, more wear and tear on the personnel as well, that they're becoming exhausted. The fatigue, the compassion fatigue starts kicking in when people are going to call after call after call. And if they're not seeing that there's necessarily, and nobody wants to see emergencies, of course, but nonetheless, it does impact the responders when they're looking at people that are taking the ambulance ride. They don't really necessarily need that. So something that we could probably talk about a little bit more in here. What they were looking at is the interventions, and I'll talk a little bit more about these as well. The Community Coalition, which essentially is that EMS interest group, again, along with expanding it out into the community to find out what does the community want out of their EMS service? What are they looking to see? What can be done different out there? The second thing is another intriguing concept, and this is priority dispatch and pre-hospital care. And I'll talk a little bit more about that. This one is somewhat related to the Community Coalition, and that's sending out a survey to the residents that live here and find out what, again, are they looking for in EMS. Okay, the Community Coalition, first of all, like I said, is just reinvigoration of the EMS interest group. Maybe a little bit more, but essentially that's it. Now this one, the priority dispatch and pre-hospital care, I'm going to jump ahead a slide right away so you can see what that's all about. Now the way that this concept would work, and there's different ways to go about doing this. But let's say that there is a call into 911. We could do an option where there'd be an alternate call center instead of calling 911. It would be it'd be a nurse call center. They'd receive that call, and they would talk with that patient about possibly non-EMS transportation options. Are there some mobile apps that they can use? So take a look at symptom checkers, the telehealth, what have you. Is there some volunteer community first responder program? And a when to call 911 education will be part of this as well. This project, Wassa Fire did something like this a couple of years ago. I don't know if they do it anymore, but their paramedics went out into the field, out into the city, and provided non-emergency based care to the residents of the community. Here's the implementation of it. First of all, you have to have funding for a call center, determine how this is going to be paid for and how it's going to work. They can envision a healthcare professional working in his field, taking those calls, and basically working the callers through a standardized set of questions and tracks on how much care is truly needed for those people. This is that education component down here, getting it out to the public as far as talking to them and getting the message out, when to call 911, what's a true emergency, and when is an emergency or a situation where you can simply make an appointment with your physician later on, and it can wait a couple days. Those are the type of things that we're looking for, again, with the intent to reduce the amount of non-emergent call, decrease the cost, and increase the trust and confidence in the community. Community stakeholder survey. What they looked at is let me jump ahead. These are the folks that be involved in, of course, but here's maybe a better example of it to see what the questions that may be asked. And the survey would ask these questions. Have you ever needed to use EMS services in the county? If you have, how satisfied are you with it? What type of things haven't been addressed? Those are the kind of things that you send out in the survey just to get feedback from the community, because it's really not happening right now, as far as I know. Individual services might be doing it, but it's certainly not done on a county-wide level. I like this one a lot. The impact of it is the communication, getting the opportunity to speak more, to have that interaction between EMS and the community, besides just responding on calls, find out what exactly is going on out there to get a better idea of what the community is looking for, and evaluating the effectiveness of EMS as well. Here are the outcomes that they're hoping to get through these options, whether it's reduced response times and costs, decreased EMS burnout, and more appropriate care. And again, that concludes the presentation. Do you have any questions on this particular group?
Any questions from the committee?
This is Supervisor Mask.
Yes.
How do I phrase this? Are you aware, are some of these unnecessary calls to 911 from elderly people who just cannot get out to get to the doctor and have something happen where it's a non-emergency thing? And my second question is, how in the heck are you going to train people to not, when they panic, dial 911?
Both great questions. First one, I don't know. I don't have that information. I could speculate, but that's purely what it would be. It would just be a guess on what we would be dealing with out there. But I would hope that that's something we could determine with the survey if we did go forward with that. The second part of it, there's some concerns with that on people calling 911 and how to educate them better. Of course, the liability issue. What if they call this nurse center, they don't get an emergency ambulance when in fact they actually did need an emergency ambulance and something happens? How is that going to occur? How is that going to go down in the community? So good questions, and I don't have all the answers on that, but it's worth exploring a bit more if this is something that's been feasible and something that's been worked out in the state. That I just couldn't tell you.
Follow up, it would seem that if people were calling 911, if our 911 dispatchers were tasked with maybe referring someone else, a person calling to someone else, you're talking about the liability thing there too. Wow, this is going to be quite the project. I mean, I think this is a great thing, but I think it's going to be very difficult to weed through this.
There are other options out there, and thank you for your comments. Some other thoughts to come to mind that were not identified by the students, but in our discussions, we did talk about some other options or recommendations that we could explore a bit more. That might be the development of an EMS agency for the county, or possibly not an agency, but how about an EMS chief or a coordinator for the county? Someone that would be the liaison or someone that would be the point of contact, someone that could collect that data that you're looking for as far as what's the non-emergency calls and what's aren't. Because right now there really isn't anybody that does that. We don't have a good grasp on response times, for example. That information is available from dispatch. I could certainly go get it. But without having someone overseeing it on a regular basis, is it of value? That's what comes to mind as well. We could take a look at exploring agreements with other departments to cover larger areas. Some other thoughts come to mind as far as developing a feasibility study for the county and providing EMS, not fire, just EMS. Is that possible? Is that something that the county would like to go forward with? So there's some of the options that I see. There are vendors out there that do provide feasibility studies, and it's something we could certainly explore. I'd be willing to explore.
One more follow-up, Mr. Chair.
Go ahead.
What about frequent flyers? If your survey is out there, maybe you could determine who the people are who are, I wouldn't say abusing the system, but have no other resource. I would never want to say that because I feel sorry for anyone who is that desperate that has to call 911. But I think that there are some people out there that have chronic issues and probably would be considered a quote unquote frequent flyer. And by having a resource which would address these people maybe on a regular basis, go to their homes and check up on them on a non-emergency thing. It would take funding, but there would be something there too that could be incorporated into this.
Good stuff. I think that would certainly tie into an outreach to make sure people are aware of non-emergency transport services that are out there, that do exist in the community, that they are available for them, that they don't have to call an emergency ambulance, that there are other vehicles available for them to get to the healthcare service they need.
All right, thank you. Go ahead, Lance.
This is Administrator Leonard, and I want to thank Phil. I think he did a great job of teeing up our next issue that we're going to talk about. When Phil talked about the evaluation that was done through the university year program, he referenced that we really didn't get through that program into this idea of consolidation. And why is that important? You're going to have two local elected officials talk to you in just a minute. But there is an opportunity provided for by statute, and For those of you that attended the Wisconsin Counties Association Conference in September, you may have attended a presentation on this very topic, but it's the opportunity for a county-wide EMS system. Not fire, like Phil referenced, but emergency medical services. And that's actually provided for under Chapter 66, which is the levy limit section, and it's specifically exempted from those levy limits. So the amount of funds that is necessary to operate a county-wide emergency medical system is exempt from levy limits. And at the same time that Phil has been working with the students from the University Year Program, the same time that the WCA conference was held, and we, for those of you that attended, I attended that very presentation. It was from Waushara County, and the individual that oversees their county-wide system. And I want to make very clear, there are still struggles in a county-wide system. Recruiting and retention, all the things that Phil talked about, those are still very real challenges that are faced by those county consolidated systems. But there is the opportunity to do that. So at the same time that all those things were happening, we had local elected officials that were meeting and talking about their challenges that Phil talked about relative to retention and recruiting. And those things have snowballed into ongoing conversations. And just like Phil talked about, this potential for a feasibility study to say, what is the next step for Marathon County? What does, if we want to move in the direction of a consolidated or county-wide system, what might that look like? And I certainly don't have the answers to that, but you have Mark Maloney and Keith Longenhan here. They asked to, again, follow Phil's presentation and just talk to you a little bit about the conversations they've been having as two of the individuals that I've referenced, two of the elected officials, and the challenges that they're facing on this issue, and perhaps what their request may be of the county. So thank you, Mr. Chair.
Okay, I'm Keith Longenan, and this is a colleague of mine on the SAFER board, Mark Maloney. I guess where this all started from was probably middle of last summer. Steve Hagman, chairman of Town of Mosney, and I were talking about a road that we have joint services on, and Steve brought up the fact that Mosney Fire District is not, they're looking for a fire chief. Again, I guess they've been revolving somewhat here in the last couple of years, and I, being a member of SAFER board, didn't think a whole lot about it. I says, well, why keep looking? Just join SAFER. We have a chief. And we got into more of a depth conversation about holding a meeting. I said I would host it. So what we did, so we didn't violate any open meeting laws or anything, we invited the top elected official from each municipality, and we never organized, we never call anything to order. It's kind of like a card night or a bingo night or something. But we've met every month except December since last August. And the municipalities we invited were Rib Mountain, Village of Weston, Town of Weston, Village of Croninwater, Town of Gunther, Town of Knowlton, Town of Emmett, Town of Bergen, Town of Mosney, Town of Marathon, City of Mosney, Villages of Maine, and also Town of Event. Rothschilds and Schofield, I had a conversation with them, they chose not to attend. So, piggybacking what Lance said about our conference, that generated quite a bit of interest from the people of Marathon County that could attend our conference with that presentation. So in November, I invited Brian Donaldson to our meeting, being the Director of Emergency Medical Services for Waushara County, who went to a county consolidated EMS service within the last 2 years. And I believe this was the third place, I think, that he had been at where he put together, he called himself, what was it, a gypsy director or something like that, because this was the third place that he had put it together. And so we met again now last week, and we've had pretty good attendance. It's not always the top elected official. They may have their supervisor come or whatever, but we make sure there's no quorums. And we met last week, and talked more. The meeting that Brian Donaldson attended, Lance attended, Phil was there, Rentmeister, Chad Billop was there, someone from communications was there, and all seemed pretty enthused that we were actually meeting and concerned about this. And after that meeting, Louis Danzig, chairman of the town of Gunther, told us that if they see an ambulance within 28 minutes of the call, they're happy. And when we look at Marathon County's vision statement on the wall there about safest and healthiest and prosperous, 28 minutes, I guess if it was someone that I was with, I'd be pretty concerned waiting 28 minutes. In my own township, about a month ago, we had a logging accident, and the person had gotten a head injury and was losing a lot of blood, and Safer, to their credit, was there in 6 minutes. That's pretty good compared to 28 minutes. And when you take that all into consideration, we determined at our last meeting last week that we think we'd like to see the county do an RFP for a feasibility study, and probably wouldn't hurt to include fire if it wouldn't be a lot more, but it's all about safety, so. Mark, if you've got anything to add, you certainly can.
Well, I, along with Keith here, am on the SAFER board, which is the Village of Weston and the Township of Rib Mountain, and we have several contracts with area municipalities for fire and EMS. And the constant drumbeat we hear over and over and over with all of our monthly meetings from our chief and deputy chief is just the constant training of EMS and fire people. Most are part-time. You know, we've got some of these people working 80 hours a week with no benefits, you know, and we've got a gentleman that travels from Sturgeon Bay and is on our department, and now he finally got offered a full-time job in his area, but he's still gonna stay with us part-time because he enjoys our fire department. It's just amazing the respect we have for these individuals that are out there and wanna help and save lives. And, but it's just constant, and the minute they can find something full-time, we can't offer full-time. But I'll tell you, with the duplication that's happening in this county at all these area departments, and all this training, and all these people doing the same thing, but for their department, you know, as a safety issue, we need to do this, I believe, at a county level. And we all need to participate. And there's gonna be some kicking and screaming, and this is my place, and, you know, beating of the chest, but it's, the overall thought is for public safety. That's what it's about. And how can we enhance it, and how can we make it better? And if it means that we've got to put hubs in different areas of the county and have it run by one group by the county, I think that's the way it is. And for this feasibility study, you know, the Village of Weston earmarked 10% of the ARPA funds to the EMPD, our police department, that we share with the city of Schofield and the town of Weston. And we also earmarked 10% of these funds for our fire department, for SAFER. And I am willing to bet that either from SAFER or on the village board, we'd be very willing to participate in helping fund this, if it's a funding issue. I don't believe it should be a funding issue, but we would certainly be part of that. Something has to happen here. Keith is right. I think it has to dovetail into fire, but I think we have to take a small step first and do EMS first. EMS is saving lives. The police and the fire is the same thing, but EMS is strictly for public safety. 30 years ago, I remember having meetings with area municipality leaders about the same subject, and 30 years later, we're still talking about the same thing. And we need to help these area outlying municipalities. They can't do this on their own. They can't have these contracts. They can't afford these contracts. And if listening to the gentleman from Waushara County, I believe, the so-called gypsy, who has been extremely successful, I'm sure my mouth was just hanging open listening to him for about 2.5 hours about what they do. I mean, just to hear what they pay for an ambulance, we're paying double, because ours is completely You know, we designed the ambulance because we think we know what we want. He's buying ambulances for $150,000, and we're paying well over $300,000 for our ambulances. So, I mean, for every one he buys, you know, every one we buy, we could have two. And the thought that all these ambulances should be the same in the county and not all different, that all these personnel could actually run and handle the same ambulance, the same equipment, to help save lives. That's what it's all about. So if you have any questions, or we'd certainly be able to take them for you, but that's what we have to offer.
Any questions by the committee? Go ahead, Donna.
I have a question for Phil Rentmeester, if it's not too late to ask him something.
Phil, are you still on?
I am still on.
All right, go ahead.
All right, thank you. What I was wondering is, when the ambulances are called, do you have any data on, if it's called, how many cases of car accidents, how many cases of drug overdose, how many cases of attempted suicide, how many cases of feeble elderly ladies calling? If
Sure.
you have any data on that, or how many cases are COVID, because that seems to be the big issue now and why a lot of people are leaving employment. Thank you.
Sure. Sure, great question. I do not get that data. It can be accessed through the Department of Health Services through the state of Wisconsin, because all ambulance services have to report in their patient surveys through their data reporting software. That can be captured as long as it's not HIPAA non-compliant, or if it comes in contrast with that. But it can be captured. I just don't have that availability, and I'm not so sure the sheriff's office could even capture that as well. That's something that would have to come through DHS.
Thank you.
I have a couple-
Supervisor Mask?
Go ahead, Supervisor
sorry.
Mask.
Okay, sorry. I represent District 24, which town of Gunther is in, and if things work out right, I'm going to be losing my townships, but I will be representing the city of Mosinee. So it's the same fire district. But I have heard from people in both areas repeatedly that the response time is really bad. And that is not acceptable in today's society. I do believe that we need to change how we're doing things. And I think that we're on the right track if we continue to consolidate and do it properly. And if it takes ARPA funds, Lance, we need that too. Thank you.
I have a couple things. I actually, going way back, I went to school for fire science down in Madison. So when he said Mount Horeb, so Mount Horeb had the program in place, and I went to school with three of the guys that were on their fire department. And the reason that was put in place is Chuck, I can't remember his last name, the instructor is actually the chief of Mount Horeb, and he was the instructor for the fire science program in Madison.
It's Chuck Himsel.
That's it, correct. So a couple things with EMT. I got my EMT when I was a senior, like this program's talked about. I went through the EMT training. And I think the big thing with fire and EMT is when you get into the training, I think, especially for the local municipalities, the smart ones, they want to fight the fires, but they really don't want to go get somebody off the road. I mean, that's kind of what I've always looked at it as. And there is overlaps, I feel, big overlaps with fire, but there's not a lot of overlap with EMS as far as the first responders and EMTs and things like that. And I agree with what these two gentlemen said. It's going to be a struggle with some of the townships and some of the local municipalities. They get a sense of it's our department, and they're volunteers for the most part. They're doing the best they can with the limited resources. And I think it's going to take a soft touch to get some of this through. And you're right, I was the chairman for 10 years, and there was struggles 20 years ago in our township, and it's never gone away. And it's usually funding and getting personnel, and you have a great fire department, and then 5 years later it's not so great, and then it's great again. You get like a flux of this when you're dealing with fire personnel, especially in the municipalities. So it'll be a long road, but I'm glad somebody's actually taking the initiative to do it. I guess the question I had is feasibility study. If we do a feasibility study, because it's EMS and because it's per chapter, we can take the funding above and beyond, correct? We can go to, I mean, how does that all work as far as, we couldn't even do that for a feasibility study because it's for the next year, correct?
This is Administrator Leonard. I'm going to hopefully answer your question. With respect to funding for the actual service, and I'll be very honest, we haven't looked into this because, in great detail, because it hasn't been identified as a priority by the county board to do the feasibility study or investigate significantly. But as I read Chapter 66, 0602, specifically subsection 3E sub 6, which is the exception for funding under the levy limits, there is an exception for the amount that a county would levy in that year for a county-wide emergency medical system. I haven't done a whole lot of looking, and maybe Phil knows, but I haven't found a definition of what a county-wide emergency medical system really is and if it's formally defined. I do know from speaking with the gentleman, I attended the presentation at the Counties Association from the director that both Keith and Mark referenced from Waushara County, that they can look and feel different in each county based on what my understanding is. So to the extent your question was, does the county have the ability to access funding above and beyond the tax levy it can today, should it choose to operate a quote-unquote county-wide emergency medical system? That answer I believe to be yes. The funding for a feasibility study, I certainly do not believe would fit into the levy limit exception for how you could fund that. I haven't looked at the American Rescue Plan Act guidance, the final rule that was just adopted and that takes formal effect April 1st, whether or not a broad feasibility study like that, which I understand Keith and Mark are requesting, would qualify under any of the defined ARPA guidelines. That said, as all of the board members are aware, there are some pretty broad guidelines or broad uses that are provided for under the lost revenue calculation within the act. So should the county identify this as a priority for the Office of the Administrator to put out that RFP for a feasibility study, my belief is we'd sit down, Phil and I would sit down and really start to put that together. And I think Phil has done some brainstorming thus far on what a feasibility study might look like for this topic. And then we would release that and see what responses we get. I do know there are a number of entities that do respond to these sort of requests for proposals. Again, the gentleman from Waushara County in the presentation to the Counties Association, as well as that meeting that Keith referenced, he made reference to his experience, not only within the state of Wisconsin, but outside of it, putting together these county-wide systems. And like I said, they can look fundamentally different in different communities. I recall him making reference to one where it was really a partnership with a local health system to carry out some of the ambulance service. Whereas in Waushara County, the current system, as I understand it, is, as Mr. Maloney referenced, essentially hubs strategically placed across the county that are staffed with county staff. So it can look and feel different based on my understanding and the limited amount that I know right now. But the funding for the feasibility study is something, as Supervisor Mask referenced, if there is a request from this body to move forward and develop a proposal for the utilization of American Rescue Plan Act funds and working with local municipalities like Mr. Maloney referenced, I'm happy to have those conversations on behalf of the board. I would simply ask that the board provide me that direction to do that.
So to sum up, you'd want us to put it on your work plan?
I think that would be the most appropriate thing. I mean, I'll be blunt with respect to the work plan. There's far more on that work plan than 4 people could get done. And certainly a lot of this stuff on the work plan isn't work that I do, but directly, but try to marshal those projects through. There's a lot of stuff on that work plan. So some prioritization, which I understand the executive committee is going to be meeting about next week, really is going to be helpful. And this project, again, if the board determines that this is a priority, we'll make that happen. And I know, like I said, Phil's already done some brainstorming on it, as have I.
Well, in regards to the, what priority would be, in my mind, when I hear Keith say things like 28 minutes, so what we always were told for EMS is the golden hour. If you have any type of trauma-based thing that something happens to someone, you have about an hour to get them to that hospital, or like the success rate for that individual goes like this. So you're not getting that even close to that golden hour when you figure that somebody's getting there in 28 minutes and they got to assess the patient. That's at least a 15-minute ordeal. Get them then get them to the hospital, then get them in the ER. I mean, we have a gap in service, and that's a priority in my mind. But that's just my thought as far as which way we go on this.
Oh, I think that your priority is right on track. Do we need a motion on anything here?
We have this down just as a educational, but I would put it on for actual recommendation on next month's agenda, and then actually talk, if it's I can just get a verbal to talk with Lance about putting something on the agenda for next month, basically. Because there's some front legwork I think that we need to do before we do that. Go ahead, Lance.
To your specific question, Supervisor Mask, I think the other piece here, and I referenced this before, is that the executive committee and the full board are actually going to have the opportunity to review the work plan and prioritize where our resources go. And if there's a consensus at the committee that this is a priority, that can be added to the work plan, and that can be discussed at the executive committee to have that item considered. But it is, as Chair Boots referenced, it's simply before you for education today to update you really on the university year project that Phil had done. And then, as Keith and Mark referenced, there's kind of been a concurrent series of meetings, as I'll characterize them, that have been happening in the community alongside the work that Phil and the students from UW-Madison have been doing.
That sum it up for everyone? Did we have any other questions or comments at this point? Otherwise, I would just, like I said, talk with Lance about this a little further, and Keith and our safety coordinator, and get something to the executive committee as far as our work plan. All right, thanks a lot, guys. Sorry, what?
Oh, I just said that sounds good.
All right, thank you.
Thank you.
All right, then we'll move on to 6B, and thank you, Theresa, for being very patient. I asked if we could move her, and she said that was fine, so.
All right, thanks. Hello, I am Theresa Watson. I'm the District Attorney for Marathon County. I appreciate the time today. I know that there are a lot of very important topics today, and I will try to keep this brief. I've been with the Marathon County District Attorney's Office since January of 2002, so I'm here today to provide a little education about the District Attorney's Office investigator position. And this really was precipitated by the fact that this educational presentation was going to have more urgency in that we have had a vacancy since June of last year in that position, and we were having a very, very difficult time recruiting under the current structure of the position. So we have a pool of now potential viable candidates that I'm hoping will take care of that problem. But nonetheless, as we were facing the difficulty with recruiting, it caused us to really look at this position, how it's structured, and what the position actually does for Marathon County. And I thought it would be a great opportunity, while I had all of that information at my fingertips, to share it with this committee, because it's an investment by this committee in that position, and I think it's important for everyone to understand what the county is getting for their money in this position. So I said we had a vacancy, and we split that position. It's a full-time position. We split that position into 2 part-time positions I think it was about 3 years ago. And what that allowed us to do is, it's a sworn officer position. So that allows the investigator to carry a firearm, along with other things. But for the security of the district attorney's office, that is an extremely valuable asset for us. Splitting it into 2 part-time positions allowed us to, at least at that time, and as everyone knows, recruiting has definitely changed over the last couple of years, to recruit retired law enforcement officers who are able to keep their certification, but are no longer employed as full-time law enforcement officers, but have wonderful experience that they can bring to our office. So we're able to have 2 investigators at 50, both at 0.5, for at a minimum of $62,000 a year total. That is a wonderful savings for the county. If we were to hire a full-time position with benefits, it would cost at least $40,000, close to $50,000 a year more to fill that position. So we did that hoping that we could meet, there are all these thresholds that you have to meet if you're retired. We wanted to see if we could split it up so we could recruit people who are retired. Well, Greg Hagenbuscher, who's in the back today, he's been with us for 3 years. He retired from law enforcement as a captain with the Wausau Police Department, and can do things that a new officer might take twice as long to do because of his vast experience, his connections, his knowledge of the system, and it's been wonderful. But he's been doing this on his own since June of last year, and it's been pretty difficult. So I'm hopeful that we can keep it with the structure that it is and continue to have that savings for the county and continue to have a great asset for our office with a retired officer, but I'm just not sure. So I wanted to give a little bit of background about what it is that Greg does and what that we're looking at for this investigator position. Oh, I need to share my screen, don't I? Where do I go about doing that? Right here? Yep. Okay. And right in the middle, thank you. Thanks. Hopefully everybody can see that. There's a lot of information on this page, but sometimes it helps to see it. So one of the things that I said he does is provides office security. So right now he's working the mornings. So in the afternoons, we do not have an individual in the district attorney's office for that purpose. We have been very fortunate to work with court security, and they have been willing to step up when we have foreseen security issues with our office. Because if you don't know, when we have a jury trial or a hearing where there are witnesses necessary for that hearing, the facility that we have to house those witnesses to wait for their turn to testify, or if they're victims and they have an interest in the proceeding, their place to wait is internally in the district attorney's office. So they're in the secured door and in another secured door and upstairs on the first floor. So the people that are located upstairs are our victim witness staff, which consists of 4 people, and that's it. All the rest of our staff is down in the basement. So if something were to occur, sometimes there's a lot of strong emotion. There might be individuals who don't necessarily get along that well with each other. There could be all kinds of things, dynamics going on, and they're within the confines of the district attorney's office. And so it's very disconcerting to our victim witness staff, who is certainly not trained to deal with those issues, to be in that setting without someone nearby for security. Although, like I said, court security has been great, although they have their hands full with their responsibilities. So he also, our investigator also runs criminal histories. For those of you who don't know, our county has adopted the public safety assessment for individuals in custody to determine, or to help as a tool, determine what the bond should be that is set for that individual facing criminal charges. And part of that assessment is evaluation of the person's criminal history. And we have been in the district attorney's office doing that for quite some time, because we needed to evaluate what kind of charges should be issued based on habitual criminality, other repeater status, and then our recommendations, the state's recommendations for bond. So knowing that we are already providing that to the attorneys in our office, we worked with the county and Justice System Alternatives to use that, which we are already doing, to provide it to the public, the pretrial assessor. If we didn't do that, there would have to be another person hired to provide that information. And it's extremely complex. And I'm going to show you an example of a criminal history and the volume that we're talking about every year. So there are about 3,000 criminal histories that were run in 2021 by our DA's office investigator for purposes of having that information in making bond recommendations and charging decisions. That's a lot. Our investigator also inputs very crucial data into our internal system, which is the FBI number, Social Security number, driver's license number, Department of Corrections number, because our system in the DA's office actually interfaces with the national criminal statistics for criminal histories. So when we enter that information, it's important that it's accurate, it's important that it's complete, and that interface then can occur to make sure criminal histories are actually complete for us to run, other counties to run, and other states to run based on our information. So he summarizes also the information. If you've ever seen a criminal history, which most of you probably haven't, it is incredibly not user-friendly. Lance is shaking his head because he had to review them when he was in the DA's office. It is not someone, you can't just pick it up and read it and know, it is like a different language, know what it says. And like I said, it's important to be accurate. So the review of those criminal histories is very time-consuming, especially if you don't have the experience, such as Greg does, to do that. But the other thing is, you cannot just release these criminal histories. You can't provide a copy to anyone of these criminal histories. You can provide a summary of the public information that's on the criminal histories, but you cannot provide the criminal histories themselves because it contains confidential information on it that cannot be released. So when we provide these criminal histories, it has to be compiled into a summary of all the public information that can then be provided to the pretrial assessor, or frankly to the court by even our attorneys for background information for setting bond. So we are talking about, I should pull that up because it's quite amazing. So can they see that, or do I have to switch it again? No. They can see it? Okay. So every person that a criminal history is run on, so people have aliases. It has to include their driver's license number, out-of-state driver's license number, multiple social security numbers they might have, state ID, FBI number, so on and so forth. It is quite the ordeal. So this is just to give you an example of one criminal history for one individual as it's compiled by our investigator. And this is all done for in custodies. It needs to be done by at least noon, so it can get to the pretrial assessor, more likely 11 o'clock. And when you see the volume that is being done, it's pretty amazing. So he takes the criminal history that's run for us and he compiles it. This is for one individual, where, when, what, how, and it's all compiled. As you can see, this is important information for us to have. And you can't just go on the internet and find this. You have to have special access to do it. So you can see that if this is just one individual, that has to be, you have to review the criminal history, you have to get all this information out of it and put it in a summary. It's extremely time consuming, and it's a great shared resource for us, since we were already doing this anyway, to be able to provide that to the pretrial assessor. Let's see. So I wanted to give you an idea of the numbers. So just be careful with this. This is the number of people that we have determined have out-of-state criminal histories. This is not the number of people who we are having currently in our jail for current charges with out-of-state residents, or people that we have charged throughout the year with out-of-state residents. This is people that actually these are people that actually have been charged and convicted in a different state. So, so for 2021, again, 645 people had out-of-state criminal histories, and 3,190 total histories were run. So about 19%, round up 20% of individuals over the last 3 years have had convictions from out of state. So that is something that is extremely important for us to understand as we're making bond recommendations to the court for public safety, as well as ultimately, if we negotiate or resolve a case, understanding who that individual is and what kind of rehabilitative needs or threats to public safety. So just wanted to give you some idea of the number that we're talking about. It's pretty amazing. Put that into 261 work days. So if you go back to his duties, that's only a small part of the investigator's duties, although it's now taking virtually all of the morning to do that, which is the only resource we have right now. Also, the investigator signs our criminal complaints on an average of 50 to 100 a week. So the criminal complaints are put together by the prosecutors. Charges are determined, the probable cause is put into the criminal complaint, and then our investigator reviews the criminal complaint, reviews it for reliability, and then swears to it and signs it, and those are filed. It also participates in interviews of victims and witnesses to the extent possible, and that's really restricted by other duties, but that was about 200 reports in 2021. Generate other reports on other incidents of, sometimes we have domestic violence victims that come in, and as they're meeting with our victim witness staff and our prosecutor, they review other acts of domestic violence or stalking or threats or whatever as an example, and the investigator as a sworn officer is able to generate a report of that interview, and it's used like any other law enforcement report. Also investigating bond violations. As you all know, inmates are allowed to and can make jail phone calls, they have jail email, they have jail video visits. Our investigator is very instrumental in us reviewing those, although it's incredibly impossible to do that thoroughly. He does the best he can. With Marathon County, our inmates are in Lincoln, Shawano, Langwade, and Taylor County, and he has access to those systems to review phone calls and emails and visits. He also initiates investigations for citizens who come to the DA's office and sometimes report crime directly to our office. He just actually completed a several-month-long investigation into a voter issue that I don't know how he did it in the time that he had, but he did a wonderful investigation, and we ultimately ended up issuing charges for that. Follow-up on crimes investigated by other law enforcement agencies. He's also monitoring calls that come in, especially for law enforcement. They're directed to him. So to give you some idea of the number of law enforcement calls that we are getting, we just took like a snapshot of a week. So for those of you who don't know, our attorneys review every single search warrant that comes through Marathon County law enforcement before it goes to a judge. And so on one snapshot of a week, there were 42 calls that came in from law enforcement requesting to talk with our attorneys, either for review of search warrants or legal question issues. And our investigator is fielding all those calls, triaging if at all possible, and then if not, he is putting the call to the attorney to make sure it's answered in a timely fashion. Our goal is, under 20 minutes, and I think we at one point checked it and we answered those calls in 17 minutes. So, or at least got a return call back. So he is invaluable in that. He's also a liaison for multiple issues with law enforcement. He's served subpoenas in the jail, and one of the most important things that he does for us is help locate victims and witnesses. He will use all of his resources that he knows of from law enforcement experience, as well as special locator services that are recognized by law enforcement to locate witnesses. We have trials that are going on now that are 4 years removed from the incident. So there could be, I put out witness lists lately with upwards of 50 to 100 witnesses on them. We haven't had contact with many of those witnesses for years since the initial investigation took place. So oftentimes when we try to serve a subpoena or prep that person or get in contact with the person, we have no idea where they are at this point in time. So that investigator is invaluable in tracking down that individual and trying to get the latest contact information, phone number, and make contact with that individual to try to get them served and or meet with them. So this is just kind of a really brief snapshot of what I think is a tremendous amount of work for the money that we're paying right now. And to get that kind of a resource and asset for a county at, somewhere between $60,000 and $90,000 a year total cost is amazing. So I'm hoping that we can keep that going. I'm very appreciative. I've been working with Chad and brainstorming ideas of recruitment. And I'm hopeful that we will have good news to report in the next couple weeks, that we will have another part-time position, and I really like to keep it that way for a lot of reasons. But I just appreciate your time. I appreciate the county supporting this position, continuing to support it. And I hope this is a valuable use of your time to just give you some education on some of the positions within our office, because frankly, how would you know unless we tell you? So, anybody have any questions?
Any questions for the DA? Go ahead.
Thank you, Chair. Just for repetition, what did you say that this part-time position pays, or the pay scale, and what would it be if it were full-time?
Yes, so at part-time, the minimum is $25,000 a year. Max is $36,000. And if it were a full-time person, it would be minimum of $65,000, maximum of $94,000. So total with two people, obviously, to make it full-time, would be $62,000 a year complete cost If it was a full-time person, it would be $105,000 at minimum. So they estimated anywhere between an additional cost of $42,000 to $49,000 if it were full-time.
Thank you.
Greg, what's the hourly right now? Do you know? $25 an hour. No benefits and, yep, $25 an hour.
This is Administrator Leonard, and I just want to say, I mean, that's why I asked about the hourly rate. We have released our request for proposals to have a class compensation study. Theresa referenced, you know, the difficulties we're having, the challenges we're having in recruiting, and we're having those across the board, but making sure, particularly for part-time staff, where people are not eligible for benefits, we have to make sure that our hourly rates are competitive, because, I mean, you guys are out there and you can see what part-time work makes, and you know, you can go work in a industrial setting or a convenience store, and you, I think Theresa did a good job of showing how that sort of work compares to the work that Greg and other previous individuals in that special investigator position that they perform over time. And quite honestly, our wage isn't all that above some of that other work that you can do that is significantly less stressful and demanding. So I think it's important. I'll just note, we should have our proposals back based on our timeline. Our hope is to have all the submissions in by the middle of February. And our timeline that we set out, we are requiring that the work be completed, that study be completed in the middle of August, so that we can at least have before the board a funding strategy for implementation as part of the 2023 budget.
And that was feedback that we received. I had individuals who, before they retired, had come to me and actually expressed strong interest in the position. And once they retired and they were actually able to go out and their time had passed, they were able to go out and seek employment. I reached back out to them and said, "Are you still interested?" And they responded to me that they found a much better paying job, part-time, with less stress. And that was very sad, because I know that they were very interested in doing the work, but they had other security. Actually, usually it's working security somewhere, working a part-time security job where they can provide security for a building or a business and make significantly more money. So I appreciate your time, and thanks for fitting me in today. I didn't realize you had such a full agenda, so thank you. Appreciate it.
Thank you, Theresa. All right, then we'll move on to 7A. Committee members are asked to bring future ideas, or bring ideas for future discussion. And 7B, next meeting is Wednesday, May 2nd at 1:30. I'm sorry, March. My bad. And I'll take number 8 if there's nothing else.
Move to adjourn.
Have a motion to adjourn. Supervisor Mass, do I have a second?
Second.
Second by Supervisor Lamont. All in favor? Aye.
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 Any opposed? Motion carried. Thank you very much, everyone.
Thank you for a great meeting.
Thanks, everyone.